We'll discuss the rotation of the gut. Now, we know that primitive gut, it extends as a straight tube from the anterior to posterior intestinal portal. So, initially it is a straight tube. It is suspended in the median plane from the dorsal body wall by dorsal mesentery. So, this midgut portion is just conveying the superior mesenteric vessel. For this foregut portion, it is a celiac trunk, and for the hindgut, it is the inferior mesenteric artery. Now, this midgut presents no ventral mesentery. Initially, the midgut communicate with the extraembryonic part of the yolk sac by vitellointestinal duct. As the development progresses, the midgut grows in length more rapidly than the capacity of the abdominal cavity, forming a U-shaped loop which is known as the midgut loop or primitive intestines loop. Now, this loop is lying in the mid-sagittal plane and it is suspended from the dorsal mesentery by the elongation of what? That is of the dorsal mesentery. So in this dorsal mesentery, which vessel is running? Superior mesenteric artery. Now to the apex of this midgut loop, the vitellointestinal duct is attached. Now the prearterial segment now. The part of the midgut loop which is lying in front of the artery or before the attachment of the artery, we call it as cranial part. So this prearterial segment is facing cranial and ventral to the postarterial segment. Now at this moment the first rotation occur anti-clockwise, and initially the gut which was lying in the mid-sagittal plane, now it come and lie in the horizontal plane. So naturally the cranial portion of the gut is now it is lying on the right side and caudal portion is lying on the left side. Then prearterial segment now undergoes increase in length. You can see on the right side to form the coils of jejunum and ileum. Then these loops, they still lie outside the abdominal cavity to the right of distal limb. So this is the distal limb. This is the coils of the jejunum and ileum which are formed from the prearterial segment of the midgut loop. Now another second rotation occur anti-clockwise by 90 degree. Now the coils of jejunum and ileum which were lying on the right side, now they just pass behind the superior mesenteric artery and come to lie on the left side of the abdominal cavity. Now the duodenum comes to lie behind the artery. You can see in the diagram. So this is the reason, because initially it is lying in the mid-sagittal plane, then it is lying in the horizontal plane, then another 90 degree rotation is happening and the coils of jejunum and ileum, they come and lie on the left side of the abdominal cavity. Now jejunum and ileum occupy the posterior and left part of the abdominal cavity. Finally, the postarterial segment of the midgut loop has to return to the abdominal cavity. For that, another 90 degree rotation it happens. So initially both the structures, they were lying on the left side, then another 90 degree rotation is happening. With this, what is happening? That is, the transverse colon lies anterior to the superior mesenteric artery and the cecum comes to lie on the right side. So this is happening because of the another 90 degree rotation. So all rotations occur anti-clockwise. The total 270 degree rotation it happens. Initially the cecum lies just below the liver and ascending colon cannot be demarcated. So this is the diagram showing when it is subhepatic. Now later on the cecum descends to the iliac fossa and the ascending, transverse and descending parts, they become well demarcated or they become distinct. So this is the picture showing the in adult anatomy. We'll see like this, that cecum is lying in the iliac fossa. It has ascending colon, it has transverse colon, it has descending colon. Then that is the portion, that ascending colon and right 2/3 of transverse colon is derived from the midgut, and left 1/3 portion, descending colon and sigmoid colon, they are derived from the hindgut. And but if the rotation is, last rotation is not happening, the cecum is lying below the liver, so that subhepatic cecum, so if the pain of appendicitis it happens, it may be confused with the pain of cholecystitis. Now once the rotation is happening, the gut is returned to the abdominal cavity. The next step is fixation of the gut. So all parts of the small and large intestine have a mesentery by which they are suspended from the posterior abdominal wall. But after the completion of the rotation of the gut, the duodenum, the ascending colon, the descending colon and the rectum, they become retroperitoneal. So how? By fusion of their mesenteries with the posterior abdominal wall by the process of zygosis. The original mesenteries, they persist as the mesentery of small intestine, the transverse mesocolon and sigmoid mesocolon. So in adult anatomy, we see the mesentery with these structures only, that is small intestine, transverse colon and sigmoid colon. Now these are the anomalies of the midgut, that is umbilical fecal fistula, Meckel's diverticulum, enterocystoma, respiratory tumor at the umbilicus and omphalocele. So we have discussed the omphalocele in our anterior abdominal class. Now we will discuss the rest of the anomalies. Now umbilical fecal fistula is what? As we know, this is the midgut loop, this is the vitalointestinal duct. If whole of the vitalointestinal duct it remain patent, the contents of the small gut they are discharged at the umbilicus. We call it as umbilical fecal fistula. Then is Meckel's diverticulum. Under normal condition, the vitalointestinal duct disappear completely during the 6th week of intrauterine life. So this is the vitalointestinal duct, this is the yolk sac. So they disappear by the time of 6th week of intrauterine life. But if the diverticulum appears when proximal part it persists, this whole of the vitalointestinal duct, this whole of the duct is just disappeared except this proximal portion. So it appears like this. So this is known as the Meckel's diverticulum. Now what are the different features of this? So rule of 2 seen in 2% subjects, length is 2 inches, it is 2 to 3 feet from iliocecal junction. Now, but this diverticulum is attached to the anti-mesenteric border of the ileum and it has same caliber and structure as of ileum. Now, mesentery is attached to the ileum. So, opposite to that, this is anti-mesenteric border of the ileum. So, rule of 2 it applies to it, that it is 2 to 3 feet from the iliocecal junction, then seen in 2% subjects and length is about 2 inches. So this is Meckel's diverticulum. It can lead to the following complications, that is peptic ulceration, then inflammation and intestinal obstruction. Then enterocystoma. Vitalointestinal duct is closed at both the ends but it remain patent in the middle. Then we call it as enterocystoma. Respiratory tumor is what? It is a rare condition in which the distal part of the vitalointestinal duct it persists. You can see here, rest of the duct it just disappear. Now distal part is initially it is invaginated, but with the increased intra-abdominal pressure it is evaginated and we call it as respiratory tumor at the umbilicus. Then anomalies of rotation, that is rotational defect can happen. That is, with these rotational defect, the abnormal location of the different structures, that is jejunum and ileum, it happens. So abnormal rotation lead to the abnormal location of that. So when normal 180-degree rotation fails to occur, so as a result the jejunum and ileum lie on right side and colon ends up on left side. And reverse rotation is what is happening once the anti-clockwise rotation is happening normally, but if it happens clockwise, so definitely it is lying and come and lie in front of the mesenteric vessel. So that is known as the reverse rotation. You can see in the diagram. Then volvulus of the intestine is what? The part of the small intestine or large intestine twist around itself, causing an obstruction. Sometimes the duodenum may held against the posterior abdominal wall by Ladd's band, so bands of mesentery, resulting into constriction and obstruction. So these volvulus or rotational defect can lead to the obstruction of the intestine. So this is all about the rotation of the gut. Thank you very much. If you like my channel, kindly subscribe it and share it.